record on the computer. We're ready to get started. So, hello, everybody. It is the 14th day of November. Time is flying by. And before we do get started, I'm going to mute everybody so we don't get feedback to begin with. Good to talk to everybody again. We are going to open up this for questions. And I don't know why I made Aladdin our theme for the day, but it is our theme for the day. And okay, that brings me to a funny story. My wife will kill me for telling you this joke, but it's one of my favorite jokes. I probably told it to you before, but a man went to the beach once and rubbed a lamp, and here this genie, just like this, popped out and said, "You get one wish. Anything you want, here's your wish." And the man was thinking, he goes, "Well, I'd really love to go to Hawaii, but I'm afraid of flying. So could you build a bridge all the way from San Francisco to Hawaii so I could drive there? That would be wonderful. I've always wanted to go to Hawaii." And the genie said, "You know, I could do just about anything, but are you talking about a bridge all the way from San Francisco to Hawaii? That would deplete all the cement in all the countries on both sides of the continents, and it would deplete all the finances of every country. It would ruin the economy of every country. The world would go into a worldwide depression. It's impossible. There's nothing I can do about that." And then the man said, "Oh, all right. Let me think. I guess I would really, really just like to understand women." And then the genie goes, "Do you want that 2 lanes or 4 lanes?" Okay, sorry, that was really, really inappropriate. So, but I thought it was funny. So anyhow, so before we get started, just want to remind you where the exits are. So in case of an emergency, you guys can get out fast. But it's just a weird day, sorry. Okay, questions. Let's open this up for questions. Does anybody have any concerns, anything that you personally want to talk about? The floor is yours.
Well, this is Sharon, and I'm still struggling with ascites and in my abdomen, and when it's around my lungs, I don't know if it's still called ascites.
It is. It could be called. Yep. So, are you getting it drained?
Yeah, and then I just had to have a catheter, Pleurex catheter drain put in my abdomen because I was needing to come too often. And the idea from my oncologist was, when we find a medication that works and it starts working on the cancer, then that should subside. So I've been kind of waiting for that, and I'm on, like I was on 4 rounds of one type of chemo for a month, and that didn't help it. Like, I was getting worse, and then he put me on something a lot stronger, and I've only had 2 infusions so far. And there's a little hint of possibly it slowing down, but I think he was anxious to see something a little quicker happen. So I'm kind of on that fence right now where I'm going to see in the next couple weeks which way it's going to go. But, you know, it really makes me nervous. But I guess the question I have is, I know initially if you go on a new medication, they call it like a tumor flurry, you could get a lot of fluid because of the inflammation from the cancer being killed off. So that could explain maybe from the beginning of a new treatment, but then after a while you can't keep hanging on to that. Are there patients that you know of that have cancer that are okay? They may be stable, or they may even be getting better, but they continue to have this fluid? Because I just would like to know that it's not doomsday. Like, if I keep getting the fluid, then that just means, you know.
Well, I've had patients in the past have ascites for, you know, a long time. And it would slow down and then pick up again, slow down and pick up. So just that's a side note here. Ascites with cancer, um, physiologically, there's theories on why it happens, but nobody knows for sure why it happens. So ascites is fluid that is built up in the abdominal cavity or in the pleural cavity that is the current thought is that the cell membranes are becoming more unstable and you're getting a greater amount of fluid that's being expelled into the extracellular spaces, and that's what the ascites is. That's what one of the current thoughts is. Another current thought is that it's an increase in extracellular inflammation due to certain immune cells called immune stimulators called cytokine, an increase in cytokine production from a growing cancer. It's probably a mixture of those two and several other theories. Now, ascites usually only happens in later stage, and many times you go, okay, is this, just like you're saying, Sharon, is this the end stage here for me? Is there a chance for recovery yet for me? I've had patients go through really bad ascites, had multiple liters drained off, and then it seems to dry off and slow down, and then they are stable. I have some patients that are currently in that state right now that they went through times that they had bad issues with ascites and now it's stabilized again. So there's, hold on to that hope. Don't think it's hopeless now that you have ascites. I think I have some ascites, some abdominal ascites. Um, Not enough to get drained off yet, but I can tell there's some fluid in there. So it doesn't mean that it's a is ascites in abdominal ascites or pleural ascites always a bad thing? No, if you go through a different sort of therapy, it could produce more lysis of cancer cells, and then that would produce ascites because you're literally, instead of the cell going through normal apoptosis and basically a recycling of the cell components, the cells are basically imploding or exploding or breaking down, and you have this all the cellular components just dumping into the extracellular space because the membranes are just exploding. So one of the things that can help with ascites is to help the health of your cell membranes. And so what are your cell membranes made up of? But phospholipid bilayer, a double layer of a phosphorus group attached to a lipid. So good fat sources, and that's where the phosphatidylcholine products really work well to help strengthen cell membranes so that you don't get leakage of healthy cells. Because so when one of the theories with ascites is that you have such a high ramped up cytokine production, it changes the osmolarity of the extracellular spaces, and even your non-cancerous cells become more leaky. And that's where they end up producing more fluid in the extracellular space. Well, that's not good for those cells at all. So the health of those cells has gone down. Remember when we did your phase angle tests in the office and we're looking at your intracellular versus extracellular fluid? You want that to be about a 60-40 split, intracellular to extracellular. And when that split reverses, that's when you're going to have a greater amount of ascites, or that is ascites. That is a sign of greater amount of ascites, and it's all due to a weakness or a damage or an unhealthiness of the cell membrane itself. It can't hold the fluid.
So what did you call it? The choline?
The phosphatidylcholine.
Phosphatidylcholine. That's a supplement, like a
That's
powder?
a supplement, and also good fats. So your good, omega-3 fatty
avocado.
acids. That's where the Budwig protocol can be helpful in that situation because that's going to be a good source of omega-6 fatty acids.
I know my oncologist talked about like low levels of protein and albumin.
Yep,
It's kind of not helping either. So that's probably related to what you're saying.
yep, exactly. That's changing the osmolarity of the fluid, the amount of albumin in the fluid.
Okay.
So those are some things that can help. But ultimately, you want to find, okay, if I have an increased ramp up of ascites and I haven't changed anything in my protocol, it's time to look at maybe I should change something in my protocol. And you are doing that. You're changing the protocol. So is the lysis of the cancer cells causing the ascites? Well, maybe there's some of that. And like you said, I don't want to just hold on to that hope if it's not a true hope. Well, I would consider doing some things to try to strengthen the cell membrane. So the things that you want to consider are phosphatidylcholine supplementation, um, good fats, even omega-3s, omega-6s, doing the Budwig diet. Those are things that can help.
Okay.
The other thing that I would say in this situation too is I'm going to put out a video on this hopefully in the next few days or so, some research that has been kind of ignored out there that I found about doing uh, uh, weight training for the sake of, so if I'm lifting weights, so we talk about exercise and a cancer patient. Do we want to go for a 5 mile run? Well, maybe not, because a 5 mile run is going to be a highly aerobic exercise. And a highly aerobic exercise is going to burn a lot of oxygen. And that's going to leave my cancer cells in a more anaerobic state, which makes cancer cells happy and they can grow faster. So we don't want to do that. But so I've often said, go out for exercise, go for a little walk and do something you enjoy and smell the roses and enjoy the outsides, and that could be an exercise. But what we're learning is that maybe doing some weight training, not like you're working out so hard that you're like breathing heavy and you got to stop and take a break because you're so tired breath wise. That's the difference between tired muscle wise, but working the muscles in using 5 pound weights or 10 pound weights or 20 pound weights, depending on how strong you are, and doing some curls and doing some deep squats and doing some things to for the muscles to call for glucose. So if the muscles call for glucose because I'm doing a biceps curl, then you're stealing glucose from the cancer cell.
Well,
So
I was feeling like I'm lacking that exact type of exercise you explained because I've been so, beaten down and weak, and I'm just waiting for that opportunity to even have the strength. But, I'm going to try to start out small with as little bit of that as I can
yeah, just
because
get
I
some
think
5 pound
part of
weights
like,
and do 10 curls.
yeah, part of like being weak is getting weaker because I'm not doing any of that and it's just getting worse. And I just feel like I have to break the pattern.
Yes. So I started doing, curls. And if this was a camera, you'd see how bulky and built up I am, kind of like the like
Aladdin.
this guy, right, Aladdin, right there. But I just didn't want to show off. But so that's one of the things I would suggest doing some weight training like that. That could just get your muscles to call for glucose, so that your muscles are burning that glucose, and that's going to help build muscle. It's going to help decrease atrophy. That's going to help decrease any cachexia that's going on. So we talked about that a little bit when we had that cachexia video, but many of you didn't watch it because you're not in cachexia. So um, I'm going to do a video just on weight training, so that would be helpful.
But I mean, I guess the bottom line is if I was kind of stable or getting better, the ascites should go away. Like it
If
shouldn't.
you're stable or getting better, the ascites should go away unless you're at a state of cancer cell lysis, mean you just did a
That can't go on
round of chemo. That doesn't go on forever, right?
Okay. All right. Thanks.
Dr. Connors, on all that weight training, how much stress does it put on the connective tissues that tie your muscles onto your bones? And if you have the bone cancer, how do you gauge that?
Well, if you have bone cancer, actually, so let's say I have bone cancer in my humerus. So that's the bone of my upper arm, right? So if I use a muscle that attaches to the humerus, I will increase. By using that muscle, you're pulling on the tendon that's attached to that bone. And when you pull on the tendon that attaches to that bone, you will stimulate more calcium laydown in that bone. So there's nothing better for a person to do than to use a muscle that attaches to the bone that they have bone cancer in. Now, you have to kind of know some anatomical things when you do that, because um, a bicep curl, would that help with my humerus? Yes, because the short head of the bicep does attach to the humerus. The deltoid muscles attached to the humerus, so doing some deltoid exercises. However, you have to be aware that if I have bone cancer in that bone, do I want to stress it too much where I could fracture that bone? No, but still stimulating that bone by pulling on the tendon that attaches to the bone through use of that muscle is the best way to build bone. So if you want to build bone, pull on the tendon that attaches to the bone, you'll stimulate an osteoblastic reaction, meaning a laydown of calcium in that bone. So it's even more important if you have metastasis to the bone to use the muscles that attach to that bone.
And that seems like it would strengthen the support system surrounding the bone too.
Well, it's for sure going to strengthen all the soft tissue, but people think, oh, it could hurt the bone because I have cancer to that bone, so I better just lay down and do nothing. Well, that's really probably the worst thing a person could do. So if you want to build bone, even in an osteoporotic state, you have to exercise, because it is literally the pull of the tendon on the bone via the contraction of the muscle that stimulates more calcium laydown in the bone.
Do you let pain be your guide or what?
Well, you let pain be your guide to some extent. So if I found out I have metastasis to my humerus bone, and I was able to do 25-pound curls before, it's not the amount of weight that you are doing, it's just that pull of that. So you could use no weight and just contract the biceps and just go into a biceps contraction like an isometric exercise, where you're not actually even, have a lot of weight that you're lifting, but you're using that muscle.
Maybe even like those bands that you stretch, would that be
Absolutely, yep, you could do those too.
Would PEMF help with metastasized bones?
In what way? PEMF is going to stimulate the muscle with multiple electrical stimulation. So that's going to stimulate the muscle. So that would actually stimulate bone calcium laydown in the bone. Yes, I could see that taking place. So that would be a good therapeutic use of PEMF. Yes. Also, PEMF, stimulates different pathways to take away pain too. So it could be doubly beneficial. Any other questions?
This is Ken from Alaska.
Uh-huh.
Yes,
Hello.
sir. This is Ken from Alaska.
Hey, Ken, how are you?
Pretty well. I've got one more chemo treatment. 6 for my prostate cancer.
Yeah.
Next Monday. And of course, I've been doing the Rife machine and the protocols since June 24. Would it be wise at any time to get a rescan with Rife?
Yes.
Do we?
Yes.
Okay.
It would be. You just have to look at, reality and being able to come down here. It's probably colder here than it is in Alaska.
Might be. Okay, so
Uh,
you have to have that special red color curled tube to do that scanning, right?
It's best. Yep.
Yeah, you can't do it. There's no scan built into it that I could do with the argon gas bulb.
It's not suggested that you scan
Okay.
with the
Okay.
hammer tube. It is possible.
Okay.
Anything's possible. But yeah, it would be good to do another scan just to make sure we're getting the right frequencies and
Yeah.
such. It's always good to do that.
Okay. Yeah, a long trip. I'll have to think about that. And then the ID thing, the IV gene thing, that's a whole different thing. That would give us different information, wouldn't it?
Yeah, and I don't think that some people need to do the IV gene that have availability of other markers. So like
okay.
somebody like you that has the availability of a PSA as a valid marker of how your cancer's doing, it's kind of a waste of money to do the
Okay.
IV.
But a scan might see if I needed to have the program adjusted.
Exactly.
Okay. All right. I'll give that consideration. Thanks. Besides the trip, what would the cost be for just that?
I'd have to refer to my front desk because I do not know.
Sure. Okay. All right. Maybe I'll send them a query.
Okay.
Okay. Thank you for your time. Thank you.
You bet.
Dr. Connors, this is Dennis Baldridge.
Hey, Dennis.
Hi. I have a question. I had a blood test yesterday for vitamin D.
Yes.
Only because my doctor was concerned that I was taking, 10,000 international units a day, and I was way overdosing.
Yeah, you could die.
Yeah. The results came back. The results came back, but it was actually my vitamin D level was on the very low end of the acceptable range.
What was it?
I'd have to look up the number, but it had a range that came at the very bottom of the range. What would that mean? Does that have any meaning to that?
So it does. So if a person is taking vitamin D and they still show vitamin D levels that are low, then something is going on. With autoimmune patients, your immune system can gobble up vitamin D because it's an immune stimulant. So it's very common when a person has an autoimmune disorder that they have very low vitamin D levels even though they're taking vitamin D. Secondly, as we look at a person's genetics, you have a gene called your VDR genes, VDR. Those are your vitamin D receptor genes. And people with defects on those end up gobbling up a lot of vitamin D, and they need a higher amount of vitamin D. A cancer patient that's not autoimmune, that doesn't have a lot of VDR gene defects, why would they have low vitamin D levels even though they're taking vitamin D? There could be other factors. They might not be absorbing it well. If a person vitamin D is a fat-soluble vitamin. If the person has gallbladder issues, they might not be absorbing vitamin D very well. If they have metastasis to bone, and bone is getting moth-eaten, it will drop your vitamin D levels, and the need for vitamin D goes up there as well. I can't remember what supplement, the exact vitamin D supplement you're on. Can you refresh my memory?
Good question. I have to look it up. It's like 10,000 IU today, and my test came out. Here's the results: 33, and they say the range is 31 to 100.
Yeah, and the typical test range is run from 30 to 80 is their normal range, and they think anything over 80 is excessive, and I really want my cancer patients to be over 100. So I would suggest other thing is that we might need to switch you to a vitamin D that also has A, E, and K in it.
Okay.
And that will make it more absorbable and more usable by your tissue, so you're not just flushing it out.
Okay.
That might be the reason, and it could be a combination of the some that I gave you there.
Okay. So
But the vitamin D, the one that we are using much more now is the ones from Allergy Resource, and it's vitamin D, A, E, and K. It's 5,000 milligrams, 5,000 IUs per capsule, and I would just go to those and still take just 2 a day. So you're taking 10,000 a day.
okay, and that's on your website, that vitamin D version there.
Yep. It's from Allergy Resource is the brand.
Allergy Research.
Allergy Research. I think it's yes.
Okay.
It's a small little bottle.
I have the same problem, and hello.
Yeah.
I have the same issue, and my oncologist said to make sure to take it with food, not on an empty stomach, something like more fatty type food. So
if you take it with a little fattier food, then you'll stimulate bile release. So that gets back to gallbladder issues. So if you don't have enough bile in your small intestine, it's going to make it more difficult to absorb it.
so it's okay to just take it on an empty stomach. It's just
No, so I think he's right. So if you take it with a fat, then you're going to have a better chance of secreting more bile.
Oh, okay, I see.
You gotta go.
Any other questions? Time for one more.
Dr. Connors, this is Carla. Can you hear me?
Yes.
I had sent this in by email last week, so I don't know if you got it or not. But one of my questions was with the Ion ProWave. So when I do the cancer setting one, I have like it comes out brown and there's like a little bit of, I don't know, precipitate. And then when I do the detox one, it's like black and I could barely see my feet at the end. And I think you had me doing the detox one twice a week and the cancer one the rest of the days. And I didn't know if one looks worse than the other, is that an indication I should be doing one more or not really? I didn't know.
That makes sense to me. So if you're doing the detox one and it's coming out looking like tar, then probably a hint that we need to work on that a little bit more. So remember, the Ion ProWave versus an Ion Cleanse that some of you might go to a clinic to get done, because most people don't have an Ion Cleanse at their house. But the Ion Cleanse ionizes the water and it's going to pull a lot more minerals. Ion ProWave isn't going to pull that many minerals. So I'm not really worried about a person getting a loss of minerals and needing to supplement more minerals so much with the Ion ProWave. That's the one with the True Life that most of you have at home. So you can do it every day, my point is. Especially if you're drinking your greens drink, you're refreshing your body with minerals, so you're going to be fine. So yeah, if you want to do that more regularly to try to pull some more crud out of your body, that's great. Also, when you see something like that too, you might want to think of, do you have access to a sauna?
No.
Okay.
I don't.
You just think of other sources, other ways to try to detox.
I've been doing the coffee.
Good.
Yeah, I've been doing the coffee enemas like any day that I don't have chemo.
Okay,
like
good.
The first 48 hours after chemo, I don't do it. But I've been doing that, and I've been doing PEMF twice a week.
Okay, good.
But other than that, so for those Ion ProWaves, maybe do the cancer one like the detox one 4 times a week and the cancer one 3, or?
Yeah, you can try that. Just play with it a little bit and see if you can start getting that water to come out a little bit clearer.
Okay. Sounds good. I think I had another question. Oh, I had another question about the coffee enemas. So is it better to have less volume and longer time, or more volume and less time?
It's probably better to have less volume and longer time.
Okay.
Within reason. I mean, you really only have to go up to 15 minutes, you know. So if you're, I've had patients do a coffee enema and then not have to void at all. Now that's a sign of that they're dehydrated and they're absorbing that water. We don't want that. So, but we want to be able to hold it for 10 to 20 minutes. That's our goal, really. So if you could do that really easy with half a quart of coffee, but then you do anything more than that, you have to go right away. You're better off staying at half a quart.
Okay. Okay. I think that was my questions from the email.
Okay. I didn't see your email at all. So if you ever email, if anybody emails a question and we don't ever get to it at all, it might have got lost in the abyss. So make sure you just resend it.
Okay, I can do that. Thank you.
Okay, everybody. I want to give everybody a big hug. So hope everybody's doing well. Know that I'm praying for you guys all the time. Also, I know I've mentioned if you have questions to send those in. If you have any specific prayer requests, I ask that you send those in. Just put in the subject line of the emails prayer requests so that all of us can be praying for you in any specific way that you need that you'd want to just share privately as well, because that's so important. So all right, and make sure you continue to use Facebook. Ask your questions on there too, and send us in any other ones you have. Thanks for participating, everybody, and I hope that your day is well. Bye-bye now.
Thank you, Dr. Connors.
You bet. Bye-bye.
Thank you, Dr. Connors.
Thank you.
Bye-bye.
Bye-bye.